Sir William Osler, who many consider to be one of the fathers of modern medicine, said that the practice of medicine is an art based on science. Now, he died in 1919, and we can all agree a lot has changed since then, but his words still hold true. As technology advancements, including artificial intelligence, increasingly impact the medical field, I believe it's essential that we maintain that human element, or subjective art component of medicine. I also believe that if used the right way, artificial intelligence can paradoxically strengthen the bond between patients and their physicians. I'm an orthopedic surgeon specializing in sports medicine. In general, orthopedic surgeons manage conditions affecting the bones, muscles, tendons, ligaments, and joints of the body. My specialization in sports medicine means not that I only treat athletes, but rather that I care for patients of all ages with injuries to the soft tissues and joints. My job is to keep people moving and restore quality of life. But there's a catch. No two patients and their problems are exactly the same, and the challenge lies in trying to optimize the outcome for each individual patient that I see. So, how does a doctor figure out what diagnosis to make or treatment to recommend? Well, we collect and analyze information to make an informed decision. We take a patient history, meaning we ask questions about the injury, the symptoms, and the resulting limitations. We perform a physical exam. By examining the patient, we can learn a lot about the condition affecting them. We may also incorporate other information sources, such as X-rays, MRIs, or blood tests, to help narrow it down. After gathering all of this information, we then have to interpret it. And we do this based on our own experience, knowledge, and understanding of the best available evidence. You see, what we're doing is we're already kind of creating an algorithm in our heads to help guide us through this process. Sometimes these algorithms are relatively straightforward, but oftentimes there are nuances that demand a more individualized approach. This process is also part of that art of medicine, weighing through all the various factors at play and trying to find the approach that will optimize the outcome for our patients. Recently, machine learning has been proposed as a tool to help with this process. Machine learning is a subset of artificial intelligence whereby a computer algorithm can learn to make predictions based on historical data. Now, this technology is omnipresent in our lives today and has recently started to transform the way healthcare is delivered around the world. I'd like to give you an example of this approach based on my own work, but before we get to my journey with machine learning, we have to go back about 20 years. At that time, Norway started the world's first knee ligament registry. Now, this is a database that records information about every single patient who has an ACL reconstruction surgery in the entire country. The ACL, or anterior cruciate ligament, is an important ligament of the knee that is commonly injured during sports or pivoting activities. Surgery is oftentimes performed to restore function, and I've already seen a few people here tonight who know this better than anyone. So this registry collects all this information about these patients, including the injury and surgery details, but most importantly, also the eventual outcome. Several important studies have been produced based on the registry that have shaped our understanding of these surgical techniques and surgical outcomes, rather, and guided our surgical techniques. Several other countries have since followed suit since Norway started, and there are now about a half dozen knee ligament registries around the world. So enter me. After completing my orthopedic training, I was fortunate to be selected for a fellowship in Oslo, Norway. My primary motivation for pursuing this was, it's Norway. Who wouldn't want to spend a year there? The other motivating factor was the opportunity to work with Dr. Lars Engebretsen, a world-renowned expert in knee injuries and orthopedic sports medicine. Now, during my time in Norway, not only did I develop my clinical and surgical skills, but I also became involved with that registry. And it didn't take long for me to recognize the importance of this large database that at the time contained more than 25,000 patients, now up over 30,000. It was the next year, however, during my second fellowship at Mayo Clinic, that I had what I can only describe as a life-changing beer. And it was while sipping on this beer that my friend and colleague, Ayush Parikh, introduced me to the concept of machine learning. At the time, I was only vaguely familiar with the terms, but this discussion put it into a different perspective for me. You see, Ayush explained to me that with enough data, a computer algorithm can learn to predict a diagnosis, possible outcomes, and even guide medical decision-making. It was at that point that it clicked for me, and I stopped him. So wait, you're telling me all we need is data? I think I know a place we might be able to find some data. What followed was several more beers. but also a plan to partner with our Norwegian colleagues and apply machine learning to the Norwegian registry. Our goal was simple enough: to be able to sit down with a patient in the clinic and give them a more specific estimation of their individual risk of failure for ACL surgery. The reality is that this is not an easy task for surgeons to do. Because although we can oftentimes group patients into broad categories, such as high risk or low risk, it's challenging to wade through all the various factors an individual has, narrow it down, and truly quantify that risk at an individual level. So, we developed some machine learning models based on the registry to do just that. Now, using these tools, instead of a surgeon saying to a patient that you might be considered high risk for failure of this operation, they can provide more context. And instead, they might explain, for example, that your risk of failure with this operation over the next 5 years is about 16%, and that's 4 times higher than the average. Now, our world is becoming increasingly less interpersonal. We have online banking, online shopping, and even online dating, which thankfully came about after I met my wife. But I have to admit, the idea that our medical decisions might be made by a machine is a little anxiety-inducing. Will doctors like myself become obsolete? Will patients be left to interact with bots at their next medical appointment? I don't think so. If these tools are used to augment, not replace, the expertise and compassion of our physicians, I truly believe that these advancements can have the opposite effect. It has been well published that empathy, communication, and respectful treatment, all which fall under the umbrella of good bedside manner, play a crucial role in patient satisfaction and overall well-being. By recognizing that these machine learning algorithms are just another tool or data source similar to that history, physical exam, imaging, and blood tests that we're already using, physicians can potentially engage in more meaningful conversations with their patients. For me in my practice, with a clearer understanding of the unique patient in front of me, I believe that I will be better equipped to counsel my patients on their diagnosis and treatment options, leading to more accurate patient expectations and hopefully improved outcomes. It has been over 100 years since Sir William Osler practiced medicine, and over that time, we've seen the medical profession move from a paternalistic to a patient-centered model. The next evolution is now upon us as we begin the shift to patient-specific care informed by artificial intelligence advancements. I believe that we should embrace this new technology, this new era of healthcare, but with one important caveat. We must ensure that we do not let the art of medicine, characterized further by empathy and human touch, be overshadowed by the science of algorithms. Thank you.